Well, good morning, or if you're coming from the United States, or good afternoon if you are in Europe. Welcome to this event, which is talking about the pandemic in transatlantic context and thinking about living with this virus from the perspective of democracies, the ways in which this virus has put societal cohesion and international cooperation under stress, and thinking about how the trajectory, not only of the virus, but also perhaps of democracy and of public health governance can continue over the next few months. We have two wonderful speakers with us, Dr. Johanna Hanefeld and Anand Parekh from Germany and from the US, to talk about these subjects with us. So before I introduce them, let me just introduce the series here. So this is part of a series of webinars on cooperating in a post-pandemic world, perspectives from Germany, which features experts from Germany and elsewhere to share their views on Germany's role in galvanizing international responses to common threats and challenges, economic, health, and otherwise, that have been put into sharp relief by the COVID-19 pandemic. This series is part of the Wunderbar Together USA 2020 campaign. Wunderbar Together USA 2020 is a comprehensive and collaborative initiative funded by the German Federal Foreign Office and implemented by the Goethe Institute. So the series was launched with a conversation with Ambassador Heusken in September, and the next event will be on shaping relations with China on October 26th. So let me briefly introduce myself before I introduce the two speakers. My name is Heidi Tworek. I'm an Associate Professor of Public Policy and International History at the University of British Columbia in Vancouver, Canada, and I'm also a non-resident fellow at the German Marshall Fund. And in September, I wrote a report with a team, including Suda David Wilp from the GMF office in Berlin, looking at how 9 democracies on 5 continents, including Germany, had communicated around the COVID-19 pandemic and what we could learn from places that had effective responses like South Korea, New Zealand, Senegal, and Taiwan. Our two guests bring very different perspectives coming from Germany and the US, and much more epidemiological ones than I could. So first, let me introduce Dr. Johanna Hanefeld. She is Scientific Director and Head of the Center for International Health Protection at the Robert Koch Institute, Germany's public health institute dedicated to investigating, monitoring, and preventing infectious diseases. She also leads the London School of Hygiene and Tropical Medicine in Berlin and is Associate Professor for Health Policy and Systems at the school. She worked as a program manager for national health policies at the World Health Organization's Regional Office for Europe. A policy analyst by training, she worked on HIV and AIDS, initially for the Panos Institute based in Zambia, as an HIV researcher for Amnesty International, and on health equity and social determinants for the WHO. She is a co-founder and remains an active member of the SHAPES Working Group of Health Systems Global, which aims to bring together social scientific approaches for research and engagement in health policy and systems. And joining us from just outside of Washington, DC, we have Anand Parekh, who is the Bipartisan Policy Center's Chief Medical Advisor, providing clinical and public health expertise across the organization. Since 2015, he has led specific efforts tackling a variety of policy issues, including the opioid crisis, obesity epidemic and nutrition, health and housing, domestic and global responses to HIV and AIDS, business and public health collaboration, emergency preparedness, social isolation, rural health, and prescription drug costs. Prior to joining the Bipartisan Policy Center, he completed a decade of service at the US Department of Health and Human Services, HHS. Briefly, in 2007, he was delegated to the authorities of the Assistant Secretary for Health, overseeing 10 health program offices and the US Public Health Service Commission Corps. Earlier in his HHS career, he played key roles in public health emergency preparedness efforts related to pandemic influenza and bioterrorism, as special assistant to the science advisor to the secretary. Parekh received a BA in political science, which I'm sure comes in useful, an MD and an MPH in health management and policy from the University of Michigan, and he was selected as a US presidential scholar in 1994. So we'll begin with a conversation between the three of us, and then of course we will open up for questions. So please do put any of your questions at any time that they occur to you into the Q&A box, and we'll try and get to as many of them as possible. So let me just open up by asking you, Dr. Hanefeld, if you can just tell us a little bit about where you see the pandemic at the moment in Germany and in the perspective of international collaboration as well.
Yeah, thank you, Heidi, and it's Johanna. Please, it's a new. I think it's a new sense of awkwardness listening to your own bio or introduction on Zoom. So, thank you for introducing me so well. I'm going to say briefly a little bit about where we are in Germany in terms of how the pandemic has really developed here. And then a little bit about the role of the Center for International Health Protection at the Robert Koch Institute, which is very much about the international collaboration. So just very briefly, as probably many are aware, much like the rest of the world, we had a very initial case of COVID in January. Then we experienced a rapid increase in numbers around March time, following on from our school holidays at the time. And we then moved into an almost unprecedented, together with the rest of Europe, I think, with an almost unprecedented lockdown at the end of the month of March, at the beginning of April, which then was stepwise relaxed from May, the beginning of May onwards. And we saw a concomitant decline in our numbers. We had, during that, what now would be termed the first wave, initially outbreaks or initially affected the general population, but this moved very quickly into the older population, which at the time was very worrisome and the focus of a lot of our activities. As the numbers declined between April and the end of July, we saw, or we learned different things about the pandemic. We saw the importance of certain settings that were important. So in Germany, it was around family gatherings, religious gatherings, parties, but also particular work settings, including in our agricultural sector and meat producing plants. And then really from the end of July, we witnessed an initially a very slow increase, and that was in the young population and was linked to increases in mobility in the younger population. And then since the beginning of September, again, unfortunately, like much of Europe, we saw very much an increase and then a much more rapid increase again in the case numbers. And we also saw it move from the younger population into the general population, including into the older population. And of course, that's something that we're looking at very closely because of the concomitant risks. And at the moment, we are in our second national lockdown since the beginning of November. The numbers have stabilized somewhat, but it's too early to tell. So we're seeing very high daily rates. And linked to that, we also so we have around, I think today was between 17 and 18,000 new cases, and this has unfortunately become the norm for us. And we also have seen the number of deaths per day rise. We've now got over 12,000 people that have died in Germany. So I think obviously this puts a lot of strain on the system. We'll have to see how this lockdown works. For us in the Center of International Health Protection, it has been very important. We have focused closely on the collaboration with our neighbors. And I think COVID has in many ways, for everyone who works in global health, it's in a way our mantra to know that the health of a person in one country influences the health of a person in another country. But I think in this pandemic, I keep repeating this sentence saying, the pandemic is not going to be over in Germany unless it is over in all the other countries in the world. And I think this is also very clearly what we have seen this year, how this has played out. And I think sort of as a last starting remark for me, it's really shown the power of partnership and the importance of that in addressing the pandemic, in understanding it, and in working together for the scientific solutions that are required for us to return to a more normal time again. Thank you.
Thanks. So Anand, tell us how you see currently the pandemic perhaps in the US and more globally.
Heidi, thank you so much for that question, and great to be with you and German Marshall Fund and Johanna as well. So in the United States, we're in a pretty difficult spot right now. We're in the midst of our third upswing of COVID-19. We have a record number of cases, probably tenfold compared to what Germany is experiencing right now, about 160 to 180,000 cases, confirmed cases daily, record number of hospitalizations, and really increasing deaths. In fact, yesterday in the United States, we had more deaths from COVID-19 than any day over the last 6 months, except for one day. And so, as you know, the toll from a case perspective, we represent in the United States about 20% of worldwide confirmed cases, about 20% of confirmed deaths. So these are pretty extraordinary numbers. And as a result of that, right now in the United States, you are seeing a variety of states and jurisdictions not locking down, but at least instituting measures such as limitations on gatherings, as well as restrictions in high-risk venues, be it bars or restaurants. So this is a very difficult time, I think, in the United States. I think the question is, how did we get here? And there are a couple of reasons for that. The first, on the issue of masks, we have not reached anywhere close to universal masking in the United States. Some projections are that we're at about 65% of the population. If we could reach universal masking, around 95%. Projections from many models are that we could save tens of thousands of lives over the next few months. So still universal masking, unfortunately, is more of a political symbol than a public health intervention in this country. When it comes to testing, as you know, the WHO has suggested that the positivity rate of 5% over the course of a couple of weeks is a good indicator of sufficient testing. Unfortunately, across the United States, we have 44 states out of our 50 states that have a higher than a 5% positivity rate. Some states have over a 50% positivity rate. So the pace of the pandemic is outpacing, no pun intended, the amount of testing we're doing, even though we are doing quite a bit of testing, much more than we did several months ago. The pace of spread and the transmission of the virus is outpacing our ability to test. We also got here because of really poor communication from our leaders and a lot of misinformation, a lot of mixed messaging, a lot of, as I mentioned, politicization of the response as well. And so although we have a federal structure with 50 states, there has really been no semblance of unity, if you will, or a national response. Now, there is one silver lining, of course, as many of you have heard recently. It appears that we may have a vaccine coming down the road. And so whether you call it the beginning of the end or the end of the beginning, I don't exactly know. But chances are that our Food and Drug Administration over the next couple of weeks will receive from various pharmaceutical manufacturers a vaccine candidate for review for emergency use authorization. And it could very well be by the end of the year that we'll not only have one or two approved vaccines, those vaccines will have already been, at least in some small aliquots, will have been manufactured and ready for distribution. Of course, this vaccine distribution will take many, many months. And so going back full circle to my initial point, the next couple of months will still be reliant on all of those traditional public health measures that we talk about, from universal masking to physical distancing to hand hygiene and respiratory etiquette, and being very, very careful because we are now, of course, like many countries, entering the winter months where it is colder. We're all congregating indoors. Again, most of the population will not have access to a vaccine anytime soon. So the next many months are going to be crucial for the United States. As you know, we're also in the midst of a transition of federal leadership, and probably couldn't come at any worse time even at best, when you have a transition where an outgoing team and an incoming team are talking to one another, that's one thing. But that has unfortunately not started to happen here in the United States. So, so that's really, Heidi, the status report right now from the United States.
Yeah, thank you. So let me start diving in. I've already got plenty of questions for both of you, so maybe we'll stick with you, Anand. So one question that has really circulated in my mind from the very beginning is that there's almost two approaches to this vaccine, right? Some people who say this is kind of the savior, this will be the end of it. And then the other group that says, well, even if we have a vaccine, we really need to be focused on this problem of misinformation and vaccination skepticism, because if a large subsection of the population simply refuses to get a vaccine, it doesn't matter if it's 90 or 95% effective. So I wonder if you could just give us a sense of that. So that's even beyond the sort of logistics. It's more about how do you foresee this playing out, given what's happened with masks and other aspects of the pandemic in the US? Do you have any sense of how officials or others are going to deal with this much more sort of tricky question of who's actually going to accept the vaccine and what will play out there?
I've heard a nice quote in the last few days, Heidi, this idea that vaccines don't save lives, vaccination does. And though, it has been amazing to watch the scientific breakthroughs that have led to now 2 candidate vaccines that seemingly have very, very impressive efficacy rates. And again, we have to see all of the data. You're right, manufacturing a vaccine is just one step of the process. The next challenge for the United States will be the distribution of that vaccine. And many of the states and localities simply say we do not have the staffing, the resources, the systems in place to distribute this vaccine. And so there are political questions there as to resources and funding. But even when you distribute the vaccine, to your point, the central question is at this point, what percentage of the population will want to take a vaccine? And the surveys over the last several weeks and months have been very sobering in the United States, up to almost, in some cases, a third or greater percentage of Americans saying they don't want to get a vaccine, particularly in populations that have been disproportionately impacted, communities of color and others. The rates of hesitancy, vaccine hesitancy, is even more. And so this is absolutely a concern. And I think the fact that the vaccine process over the summer and the fall became politicized and there was substantial misinformation, you've seen in American surveys a plummeting of confidence in the vaccine. So you're absolutely right. Over the next couple of months, even if we can get this vaccine through the door and distribute it, convincing the American public that this vaccine is safe, it's effective, it's not a political tool, it's in fact the way out of this pandemic. And unless we get, a good 60, 70, 75% of the American population vaccinated, it's going to be difficult to emerge by, I think we all hope, the summer of 2021 to start to reclaim the lives that we had been living previously.
Yes, I would like to get on an airplane at some point to Germany, elsewhere. So Johanna, maybe given that Germany is in a somewhat different situation, but there is also in Germany a small but very vocal group of people who have been protesting mask mandates, vaccines, and so on. So to ask you sort of the same question, how do you see this next part of the pandemic unfolding? What can be done then to combat, as I said, a somewhat different problem, perhaps smaller group of people who are often, though, very vocal and demonstrating, I believe, even today against many of the mandates from government? How does that play out with vaccines in the next few months of the pandemic?
Okay, so I have to say vaccines are actually not within the realm of the work of the Robert Koch Institute, so it's hard for me to comment on that specifically. I think what I would say is I'm very pragmatic, right? And I think the important point that Anand was making is we are all hoping for the vaccine, and we are delighted by the news of the last 2 weeks. I mean, I really have to say I think it was good news, and we are so I think we are hopeful and optimistic for it. But I think for a number of reasons, it's obviously important to say from a public health perspective, we need to keep with the other measures that we have. We need to stick with prevention, right? And especially if you think internationally, so we work internationally, this is not going to be everywhere for everyone to solve our problem magically, and we will go back to a life before COVID. So I think it will be one additional tool in our armor in a way. But from a public health perspective, I would be very hesitant to sort of overload what we expect of the vaccine in terms of how this will help us manage the pandemic. Of course, the one aspect that plays into that is vaccine hesitancy. And actually, the conversation now made me think of a colleague of mine at the London School, another Heidi Larsen, who leads the Vaccine Confidence project, who's been studying this. And this is obviously I think now it's its own field of research, in a way, anthropological research, to understand the political processes longer term that have led to that pre-COVID as well. And I think you'll always have these voices of dissent. My feeling would be that probably people are going to take that still in the world, we're in a situation where more people want the vaccine than do not want it. So, and it's against that backdrop that I would say we need to keep up all the other public health measures. And I think that's an important point that maybe I would like to stress. And my sense just from Anand's comments is that obviously this is a slightly less polarized environment in Germany that we're in. I think there's not one measure that's the magic bullet. It's about the different measures working together. So it's about you keep your distance and you wear a mask and you do hand hygiene. And if you're sick, you stay at home. And if you've had contact, you isolate at home. So I think for me, I think hopefully our interventions are going to grow and grow and grow. And all these challenges that I mentioned are there. And this is obviously a stress test, as you say in your title. This is a stress test for any society, I think. So because of the way in which the measures affect the way we're used to live our lives. And I mean, I keep on, every time I'm in a Zoom call, I keep thinking, you can see how hard it is just by the fact that I really struggle to keep not touching my face, even in even for one Zoom call, and that's a public health intervention I should really stick. So maybe that in reply to your question.
Yeah, thank you. So other Heidi and I have been in correspondence about this. And one thing that you can see, which I think is more hopeful, is that actually the vaccine hesitancy rates when you do surveys fluctuate tremendously. So at the moment they've gone up, but that can also mean they could go down. It means that we simply, I think, have to think quite broadly, as you said, Johanna, about what we mean by public health interventions and prevention. So I wanted to delve a little bit more into that, because where we are in November is very different than where we are in March, April, and we're in this sort of second wave, third wave, whatever you want to call it, but a moment when this has been going on for a very long time, when pandemic fatigue presents a new challenge, where I think there's been communication about what you're supposed to do. The problem is perhaps now compliance. So I'm wondering if you've seen pandemic fatigue amongst people in Germany or Europe more broadly, and how you think public health officials and politicians should be responding to what is a slightly different challenge than the March-April challenge. Johanna.
Okay, I was waiting for you. Well, I mean, I actually hadn't heard this term with the pandemic fatigue before. I think it's recognizing the challenges in people's lives that go on over time. And I think it's recognizing that in each of the different contexts in which the pandemic plays out, you see very different, I think you see the same measures being adopted, but we do not yet know why the measures work to differing extents in different settings. So we recently undertook a review of data where we looked at the interventions in OECD countries and the effect on the new infections per day. So we use the Oxford Policy Monitor, which looks at all the different monitors, and we did this for 37 countries to understand statistically if we could see the effectiveness of certain measures. And we had some interesting results. So it's under review, but it's in a preprint on our website. So if I plug it, but as a paper, so it's interesting. So you do see the effects of saying we don't have large gatherings and masks are effective and so on. But I think what we do not yet know enough about is why is this sort of intensity of the measure. So you can say from the research we did, for example, you could see, masks are effective, and so is the cancellation of gatherings of a certain size, and depending on the size you cancel, you can see statistically significant one has more effect than the other. But to understand the differences, to understand the extent to which this is implemented in different settings, I think is one of the things we do not yet know enough about. And I think that is because that type of research, this evaluation research, takes longer time. And I think for me, that is very, very interesting. Will be very interesting to see and understand is whether, for example, if you look at a completely different setting, you say the Asian countries, where we're sort of trying to understand, why do certain things work in settings there? You know, is it a mixture between the geography and the culture and so on, or is it the intensity with which people follow the measures? You know, do they wear the mask all the time, whereas other people maybe in other settings may not? And I think for me that is actually from a sort of evaluation scientist perspective, that's one of the very, very interesting things to understand, and that I hope we'll learn more about.
Yeah, so I mean, for me also a fascinating thing to think about, how far can you make mask wearing a habit, and how far does that change the spread of the disease, right? If you have a mask is simply a habit that you have on, and then you take off very briefly rather than something you only put on briefly, which really sort of flips the switch on how much is being worn. So I'd like to ask the same question to you, Anand, this moment of winter, and as you say, the US is in a really difficult moment, and there's certainly many people who are experiencing pandemic fatigue at the same time, but we also see Thanksgiving, students coming home from universities, most of which are sort of ending before Thanksgiving. So it's actually, although the US is in a dangerous moment, there's actually an even more dangerous one in a way coming in 10 days-ish time. So how do you think that public health officials and politicians should actually respond to this kind of pandemic fatigue mixed with politicization, mixed with transition? Do you see any kind of clear methods of response there?
Well, Heidi, I wonder whether it's the United States that came up with the phrase pandemic fatigue, because I can tell you here in the United States, everybody wants this to be over. You know, everybody is tired of the pandemic. And I think some of this is misinformation that has also led to the fatigue. You'll note that no one in the United States is really talking about lockdowns anymore. What we're trying to do is talk about things in a more sort of a precision public health way, and really honing in on how do you tie key metrics like cases per 100,000 and positivity rate to very specific community mitigation measures like limiting gatherings and restrictions on some non-essential businesses for a short duration to stop the spread. So it's really all about very targeted measures, as little duration as possible to stop the spread, as opposed to sort of large, long-standing lockdown. So again, how you communicate to the American public is so important. I think maybe two more points that I'll make, and you're right, we are approaching in 1 week time in the United States an important holiday, Thanksgiving. And from my perspective, when I'm talking to the public, I think everyone, in the United States should be celebrating Thanksgiving. We all have something to be thankful for. We just have to do it the right way. And I think for a lot of people, that's going to be celebrating it virtually. For others, it's going to be in person, but just with your immediate family. And if you're required to travel, doing so safely, and that will require quarantining and testing, that'll require masking and physical distancing. But the best way to show thanks is to protect yourself and your loved ones. And so I think, again, messaging to the American public is so important if we're going to really get through this. And I think messaging is also important when you're talking to people who think that, these public health people are just trying to take away our freedoms. And I try to flip it around and say, actually, we're trying to maximize people's freedoms, by really engaging in some of these intermediary measures. We're really trying to prevent the lockdowns that we saw from earlier in the spring. And so there is this notion also that with freedom comes responsibility, and we all have a part to play here. Again, so Heidi, it comes all back down to communication. There is pandemic fatigue, but the better we can communicate as leaders, as public health officials, and then each other to our friends and family in those circles, that's how we're going to get through the next several months.
Yeah, and obviously as somebody who's written about communications, I would subscribe to that and say, you know, we see examples of that being done effectively in multiple different places, but also to reach very diverse populations, including the US, and diverse not just politically, but ethnically, linguistically, and so on and so forth, which actually represents quite a challenge. Johanna, you wanted to jump in.
Yeah, I just wanted to jump in. I wanted to say I think we're all in a difficult situation. So I think that's very important to say. I think if we are here at an event discussing sort of the wonderful together, the wunderbar together, I think that's important, and I think we all want this to be over. But I really liked. I think the point, one of the points to make, which I think is important, is that we obviously have learned quite a lot more than we knew in February, March, April, right? And so, I mean, maybe lockdown is actually not a helpful term to use in an American context, just because it's probably got these connotations. But I think, so what we have seen here in Germany is now, people call it a softer lockdown or something, but it is because we have learned very carefully. We know much more about how the virus spreads. We know the situations in which the risks are higher. So one of the things is about the restaurants and the bars, and if people have a good time and they drink and they relax and they're close together and they sing, you know, that sort of stuff. And I think we have learned, and that's, I think, where the precision public health comes in. I think it's a continuous process of learning. It's so new still, and if you think how far we've come, I think that is actually quite amazing. So I do think maybe it's good to I mean, I'm inferring now for the US setting, but I can see how in that setting, maybe in the US, people have moved away from the term lockdown because it's not helpful to use it, and it has these connotations. But I think we're all in a difficult position. I think in Europe right now, it would be foolish not to say that.
Yeah, and I think I would just jump in and add that I think one of the communications challenges has been to continuously communicate the new things that we know, and actually how what seem like very trivial interventions can be very helpful. So for example, in British Columbia, you're now not supposed to, in any public setting, have music above the level of conversation, because it's meant to be a sort of soft intervention that ensures that people don't shout. So that if you are in a restaurant or something like that, at least you are speaking more softly. So, you know, and it sounds silly, right? But in a gym, for example, where people then aren't shouting, but are just talking, it can actually have a strong effect. But the challenge is then to communicate that this is a real public health intervention and not just sort of a silly cherry on top. So I'm going to ask one of the questions that's come in, and anybody else has questions, please put it in the Q&A. So this is a question for you, Johanna. So this is a question about schools. So do you think it is a good idea to split school classes into two in order not to shut down schools again?
Okay, so I think schools as a whole are obviously a very big issue. And I think one of the things that is very clear is that from a societal perspective, to keep schools open and to keep kids in education is definitely something that is something we need to protect. I think there's also a lot of research ongoing about the different age groups at which kids are at higher risk. I think the specific intervention depends very much on the context. So it depends on the age, and it depends on the age group, for example, of the kids, and it will depend on the also on the sort of building or the setting in which a school is. I think as a whole, of course, what we know holds, right? So to have less people in one room, less closely, to ventilate a room, and to ensure that there's distance makes good sense from a public health perspective. So it's hard to say if you have a class of 50 people and they're crammed into a small room, maybe splitting them is not enough, right? But I think you have to work on the principles that we know. I think the distance is important, and I think the air circulation, so opening the windows at regular intervals and ensuring that you don't get the concentration and the formulation of aerosols, that's important. So that's what I think you can formulate the guidance that exists on the basis of evidence, and then I think it's you know, you need to look at your setting to see what makes sense.
Yeah, thank you. And maybe I just want to follow up just asking about the US, Anand, because it's in a very different situation in the sense that so much schooling is online, and there have been these sort of debates, right? Why in New York City, for example, is the idea that schools will close if positivity rates go above 3%, but say nail salons or restaurants will be open, and what is the kind of decision making that's going behind that? So I wonder if you want to add anything about schools and how that's unfolding in the US, which is quite different than in Europe, where there's been much more of a priority on keeping all schools open and in person.
Yeah, Heidi, another very difficult question for the United States. In too many communities, I think some would argue that we haven't made the right choices. You know, why are we allowing bars and casinos to be open when we're not allowing schools to be open? And what should our priorities be as a society? I can tell you just my daughters who are in school this week, you know, they're going to be shut down after Friday just because the rates in the community are just so high, even though we're not seeing transmission really in the school, as long as the schools are doing a good job. But at a certain point, when the rates get so high in a community, we can try to be a bubble, but we're not going to be a bubble. You know, no one can really be a total bubble. So ultimately, eventually that'll trickle down into schools and we'll get cases. So in many cases right now, you're right, many schools in the US are virtual. Other schools are open, but they are going to be forced to close pretty soon, not because there's rampant transmission within the schools, but because the background community rate of transmission is so high, there's so many cases that eventually that will then infiltrate the school. So it is another difficult situation. I think we'd all want, if we had to prioritize schools, to be open. I agree with everything Johanna said, particularly for younger students, where the data looks even better than some of the older students. So that would be ideal, but it is, I would say, probably not to be pessimistic, but it's going to be very difficult over the next couple of months in the wintertime to keep kids in school in person. There's going to be a lot of virtual learning.
Yeah, thank you. So the next question is, if one or both of you could try to discuss something about how far did closing borders and public cross-border restrictions on transportation impact the spread of the pandemic? Either one of you want to jump in on that? How far did border closures make a difference?
Well, I guess I would just say, you know, at this point, particularly in the United States, the virus is everywhere. And I think it is important to message to individuals to limit their travel. And if they do need to travel, they're required to travel, to take all the precautions. And in many states, in fact, there are requirements that if you are traveling from a state with a high caseload, that you have to self-quarantine for a number of days. In some states, you have to get tested. But right now in the United States, there's just so much virus and COVID-19 transmission, you know, all across the country, that these kinds of things maybe help at the margins, but they're not going to be the silver bullet, if you will.
Yeah, Johanna, do you want to add anything?
Yeah, maybe I can just say from my perspective as well, of course, so there are similar restrictions operating in Europe, including in Germany, about quarantining if you come from a risk area and how that is defined sort of and calibrated. I think the important thing is, and I think Anand has said this, is that mobility clearly plays a role, right? But I think, again, as with I think we're sort of having a consensus emerge, or a sort of core thesis from this discussion is that you have to place that within the sort of context of the value system that's around it. So, I mean, you cannot prohibit all mobility of all people in either in the way our societies have organized, but also in the way our economies are organized, right? So it's about that balancing act. How can you keep our societies functioning while keeping our people safe? And I think so. I would focus on the mobility less than the border.
So quick follow-up from someone was asking, and this is, I think, more for you, Johanna, what you would recommend in Europe concerning travel for Christmas to see family, if you have any recommendations there.
I would again, I mean, I think there's a regulation, an EU-wide directive on which member states interpret in different ways. So there are some legal frameworks which you have to adhere. So if you come from a risk area, you have to quarantine and so on, or test at a certain time. But I think, again, I would say the big message is that mobility itself is a factor. So I think just like Thanksgiving, I think Christmas is our Thanksgiving, even though you've got Thanksgiving and Christmas, but which is good for you. But in some ways, but I think I mean, I think the key is to try and remain safe this Christmas, and to do that in a way, the same way we give thanks by, or we celebrate Christmas, but in a way that keeps people safe. So I think mobility, the reduction of mobility is definitely something that you can do to reduce risk. But I think it's within this frame. I think it's within this frame of how do you weigh those decisions, right?
Yeah, thank you. So we're going to do one last question before we wrap up, which goes back to this question of selling the idea of the vaccine to people. So what are you hearing in terms of some of the suggested arguments that are being made for persuading people to get vaccines? So is it about just saying, get it, and then we can sort of go back to the lives that we had before? Or what are the kind of compelling arguments that can be made to overcome some of this vaccine hesitancy? So we'll go to Johanna first and then to Anand.
I mean, I think if we talk about pandemic fatigue, we all want the pandemic to end, and I think the hope of a vaccine gives us a really good chance, and I think that for me is the key message. So I mean, I still see the challenge. I think communication is one of the challenges around the vaccination, but I think getting enough vaccine that we need, I think, is to everyone in the world in a fair way is also one.
So in a way, the challenge will be more, how do we manufacture enough vaccine for all the people who would willingly take it before we even get to the people who are vaccine hesitant?
No, now I'm going to tie myself in a knot. Vaccine hesitancy is real and it's an issue and we need to address it. And I have a feeling Anand is going to tell us how we're going to do
it. I wish I knew. I think that just sort of as a physician, I can say that these types of medical interventions really depend on trust. And I think the healthcare community can play a big role. I think you will see when President Biden starts on January 20th, he will have the healthcare professionals at the podium as opposed to himself. I think, personal healthcare professionals and physicians will play a large role in convincing their patients about the importance of this, the safety, the effectiveness, having role models, other well-known figures, healthcare professionals, all saying the same, sort of on the same message, if you will, I think will really help counter some of the misinformation and really build confidence. But I think it all comes down to trust. How do you generate trust in a society? And oftentimes trust starts locally. It's those local members of your house of worship or your church. It's your physician or your healthcare professional. It's the people who you associate with in your community organizations. And I think if we can sort of infiltrate at that level in a positive way to build trust, I think that's how we'll counter vaccine hesitancy and get the vaccine rates up.
Well, ending on the theme of trust seems completely perfect. I certainly have trust in everything that both of you have said, and I'm really grateful for your time that you've spent with us in helping us to talk about these tremendous challenges, but also giving us some hope in the ways that we can try and overcome them over the next few months. So we can hopefully at some point have a conversation like this in person and not just over Zoom. So thank you so much to Johanna Hanefeld and Anand Parekh for spending time with us, for giving us your perspectives. Thank you to the German Marshall Fund for hosting this under the auspices of the Wunderbar Together webinars. And just as a reminder, the next event will be on October 26th, talking about shaping relations with China. Thank you all very much.
Thank you.
Thank you.